Hi, and welcome back to the Life After 50 show. This is Katherine Watson. I've been on this morning with Jamie Spratley. She is an independent Medicare insurance advisor, and she can help you figure out all of this ABCD, all the different terms and things that you may not know about Medicare. She can help you choose what's the best option for you and your family. Everybody's different. We all have different needs, and we all have different things that matter to us. So she's able to help you kind of navigate that whole Medicare world that can be quite confusing for people, Jamie. It really can. So I thank you for being on here. We had some technical difficulties, and part of it was me. I was calling Jamie by a different name, and so she wasn't answering. But she's here now. Unfortunately, for some reason, we're not able to bring on her partner, Nicole, but we'll bring her on another day. So Jamie, thanks again for being here, and thanks for jumping back on with me so we can finish this conversation. So we had somebody that had asked a question, and those of you who were watching the last show, if you have questions, please put them in the comments section here so that we can see them. I'm unable to see the ones that you had posted previously right now. So, but we were talking about Medicare prescription, the prescription drug plan. One thing I want to ask you, doesn't Medicare pay for my medications? That's what I thought. Tell us about that.
Well, there are certain medications that do fall under Medicare Part B, and these are going to be not the common daily filled prescriptions, but these are going to be like medications that you may have administered in the hospital for certain health conditions like cancer treatments. But the day-to-day prescriptions that are filled are actually going to be between you and the insurance carrier. And then Medicare does assist you in paying for the medications once it's kind of going into the whole concept of the coverage gap, which is wonderfully going to be, if anybody knows what the coverage gap or donut hole is, it's in regards to your prescription drugs. And this will be going away at the end of 2019. But the coverage gap, in essence, is where after the prescription drug company assists you in paying for your medications up to a certain dollar amount, this year the random number is $3,750. Then you go into what is called that actual donut hole, where you're now going to go from paying a copay to paying a high percentage of the cost of your meds. And that's where Medicare does assist you in paying for your medications, because you'll now pay like 35% or 44% of brands and generics. And then there's assistance to help you pay for the rest of that. That is federal.
Okay. All right. So if I join Medicare, do I have to sign up for the prescription plan?
That is a very good question. It's actually not a requirement. However, if you do not have a prescription drug plan, then there is a federal penalty that you do incur once you do eventually enroll onto a prescription drug plan. Now, if you have what is called creditable coverage, which is VA or TRICARE, which is military, or if you have creditable group insurance through your employer, then you would be exempt from the penalty that others would incur. But otherwise, if you are a Medicare beneficiary with Parts A and B, it's not required, but again, you'll have that penalty to face. And not only that, but in my opinion, as an agent, it's always good to have a prescription drug plan, not just to avoid the penalty, because whenever they do give you that penalty, it is something you will be paying a certain amount every month for the rest of your life. It's not a write a check and you're good to go. It does not stop. It continues on. But apart from that, having the coverage is always good for unforeseen situations that may pop up. So that if you end up needing to have a medication because of, something surgical that you didn't expect, or even a prescription that you're going to need an ointment to recover from an infection. These medications can cost hundreds of dollars. And so having a prescription drug plan will help you cover those medications considerably.
Yeah. Yeah. That did happen to my sister. She did not opt in for the drug plan because she was very healthy at 65, and she wasn't taking any medications. Mm-hmm. Unfortunately, about 5 years later, she had some serious health issues to do with her heart, and she needed to take medications. And now she's penalized, like you said, for the rest of her life. And It stinks, but you need to know that ahead of time, up front. And that's where, working with somebody like you and Nicole can make a big difference. A lot of people think that they can just go on Medicare and sign up for a plan. Yes, you can. But I think it's worth it to get the advice of a professional who knows the ins and outs, knows all of the different things that can and may happen, so that they can advise you what's going to be the best option for you. And I like in our last conversation, we were talking about how you do an assessment of their needs, and you look at, because every family is different, every person is different. And what I need is going to be different from what my neighbor needs. So just because my neighbor is on XYZ plan doesn't mean it's the best plan for me, right?
Absolutely. Absolutely. There's so many different varieties, and that's why we, our agency that we go the broker route, where we're not just contracted with one company, it's several nationally recognized companies. And at the end of the day, the company that we're going to recommend for you is going to be the one that's going to be best to fit your needs, because everybody's needs are very different. Whether they need a network or no network or out of network, everybody's doctors takes different type of insurance plans. And, another important thing to know as well is that all the different companies' prescription drug plans, their formularies are different. They're not the same across the board. So making sure your prescription drugs are covered by that particular plan is very important. And the last thing that you want is to go on that insurance, and then you find out when you go to fill your prescription that it's not even in the formulary. And then you have, you're locked into the plan until the following year. So the research and understanding that is very important. And, another thing that's anybody can always reach out and ask questions, whether you're in the state of Texas or not. We'll always answer it to the best of our ability if it's outside of Texas. But in Texas, for sure, the legalities of certain things are a little bit different, varying by state. But we always want to be able to educate and help you understand. It's not that we want to just say, this is the plan, you should do this one. It's about you understanding your Medicare options and the foundation of Medicare, because it can be very confusing. But it's really important to know because, in my opinion, Medicare and your insurance is one of the most important decisions you're going to make for the whole year. So we want you to be confident in the plan and the type of plan that you choose.
So once you choose a plan, you're not able under any circumstances to change that plan for a whole year. Is that correct?
There's going to be certain situations. You're going to have what's called, you have your initial enrollment. So that is if a person is turning 65 and they're going on Medicare, then they have a 7-month window to be able to look at and choose an insurance policy. Then you have what's called special election. And this is where the government, where Medicare sets aside certain situations that will allow you to choose a plan during the year. A couple of examples of that would be if you're moving from one county to another. If you apply for Medicaid and you get approved, there's likely to be a plan that's going to be better to fit your needs since now you have that state assistance or you have that federal assistance. There's going to be, if you're coming off of group insurance, maybe it's June and you're retiring and you're going to be coming off, then the government does give you a window of time to choose a plan. So there are certain special election situations that allow you to change. But for everybody else, it's going to be what's called open enrollment. And for this year, it's October 15th to December 7th. And this is where you can reach out to your agent and ask questions, go to some meetings, do a little research. And if you do an application between October 15th and December 7th, then your effective date will be January 1st.
Okay. All right. We have a few people that are asking questions. Kim, if you could please, you wanted us to go back to the question from the earlier live session. If you would please type that in again. We cannot see it right now. So if you'll type that in again, we'll be able to answer that. Here's one from Angela. She says, what circumstances can someone enroll in a Medicare plan?
Well, Medicare plans, so that's going to consist of if you are looking at a Medi-Gap policy or if you're looking at a Medicare Advantage. So if you are turning 65 and you're going on Medicare, even if you're on group insurance and then you're retiring and you're already beyond the age of 65, as long as you have your Medicare Part A and B, the Medicare Advantage plan is going to be there and available for you to enroll in.
Mm-hmm. Okay. All right. And let's see if there's any other questions. It looks like Nicole is not going to be able to join us, but we'll have her on another show. There's always technical difficulties from time to time, and we just deal with that. Let's see, what else do we need to talk about? I think we've covered pretty much everything. So we've got Medicare A and B, and let's see, Kim is putting her question in again. Let me go ahead and pop that up and let's ask that question. She says, I am the POA, the power of attorney for my dad, who's in an assisted living with nursing care. He has United Healthcare AARP with A and B. Is there another supplemental that covers assisted living?
Supplemental. Well, you're going to have coverage. If he has the Medi-Gap, it looks like she's saying the Medi-Gap policy. So there's going to be set coverage that Medicare has. And then any of the other supplemental type policies that you have to cover the exact same thing that Medicare does by law. So as far as a separate type of policy, the standalone policies for continued assisting as far as that regard is going to be like a long-term care policy. And that's going to be a separate standalone type policy.
Yeah, that is not going to be covered by Medicare at all, Kim. If we're understanding the question correctly, you're wondering if there's something that can cover the assisted living expenses. And the only thing, as Jamie is saying, would be like a long-term care policy. But chances are, if he's already in assisted living, he's probably not going to qualify to purchase one. So those of you who are still young, you might want to look at that option. Medicare does not pay for assisted living. So that's something that everybody needs to understand. Medicare is, it takes care of your health care needs, not your living needs and your other care needs. It's basically, it's health care insurance, right?
Correct. Yeah. I mean, the type of assistance that you will get on Medicare is going to be like home health care, which I understand is different than assisted. So there is some availability to have them come into a home and help you up to a certain amount, but that is going to be whenever you're at your personal, residence. Basically.
Right. And actually home health care can come into an assisted living facility, but it's not going to give you the kind of care that most families are thinking it's going to. It's going to be very limited, task-oriented type of care.
Yes.
And that's covered by Medicare. But unfortunately, right now, Medicare does not cover any of these. Now, Jamie, I don't know if you heard it, but I heard talk through the grapevine that some home care, and I'm not talking home health care, I'm talking home care, which is going to be more of your companion type care, taking care of grocery shopping and transportation and the day-to-day activities that people need help with. I've heard that some of the Advantage plans in the future may be covering that. Have you heard anything about that?
Not specifically. A lot of the companies, though, they do not release any changes or revisions in their plan until October. So they don't give us too much insight on that. I'm familiar with the assistance as far as that program or that being available, because a lot of people that get approved, or if they've applied and they have state assistance or federal assistance with Medicaid, then they receive extra benefits. So the fact that that possibly could be coming over to the Medicare Advantage side, even if you're not low income, is extremely exciting. So I'm very much hoping that that's something that would be introduced this year.
I think that could be a huge help for a lot of families.
Very much.
Yeah. Yeah. And I'm not sure, maybe it won't be this year, maybe it'll be the next, but I have heard through the grapevine that that's coming. So we'll keep our fingers crossed, and I'm sure as soon as you get the word, you'll let us all know, right?
Yes, we've started doing blogs. And so anytime there's any information that comes to light, and that is a huge topic of importance, then we will definitely be adding that information into our blog. And
let me just go ahead and put your website up here so that people know where to find that blog. Okay. So it's myhoustoninsuranceagent.com is the website where you can connect with Nicole and Jamie and find out more information and set up an appointment that I presume you take appointments with people one-on-one to help walk them through and sign up choose their plan.
Absolutely. And we have the number that's listed as our cell phone. You can call, you can text, email. We get a lot of emails. That way we can kind of touch base and understand what your specific needs are. And then we can kind of go from there and working towards an appointment. Or some people, if they live in a certain area, then they want to, as far as Texas goes, and then they would like to do everything through the mail or through fax. We're very flexible, but just more than anything else, if you have any questions, don't hesitate to give us a call or email us, because we're here to help you with that in any way possible.
Okay. All right. Great. Jamie, is there anything else that you think we should tell people about with regards to Medicare right now?
With regards to Medicare right now, I would probably say if I was going to mention anything else, it's just understanding if you're going to be speaking to an agent or going to a meeting and, you're looking at a plan and it looks like a great plan and you're wanting to enroll with that company. If there's anything that I would say for you to ask your agent or anybody about, it would be how the network of doctors work if it's an HMO plan. There are HMO plans and that stands for Health Maintenance Organization. They have a network of physicians. So a lot of times you're going to see a lot of great additional benefits like vision and dental, and they're going to have conservative outline of copays, and it'll be generally $0 a month. And then you have the network to abide by. But the networks don't always work the same with each and every insurance carrier. You're going to have one that may be a pod, which means that you're going to have a pod of doctors in your area that circle around whoever your primary is, and you would need to stay within that pod. But then you also have open access Medicare Advantage HMO plans, which means they may have a network of 8, 10, or 12,000 doctors, and you can move throughout that network. So I just would like to make sure that people know that when they're enrolling, just know, is it a pod or is it an open access? Because once your plan goes into effect, the access to the physicians is going to be very important. And we just never want anybody to be, and it's happened in the past, whenever we've had people come to my meetings, they saw a great plan and they did an application and they even just did it over the phone or online, and they didn't know to ask the question, understandably so, because Medicare is very confusing, but how the network works with the physician.
Mm-hmm. Okay. Yeah, that's very important. Mm-hmm. Choosing the right plan is everything. I really, I thank you for coming on here and talking about that, because I do see a lot of people and I talk to a lot of people, and they get sometimes bedazzled by some of the bells and whistles that some of the plans may be offering them, but it may not be the best plan for them. Or like I mentioned before, sometimes their neighbor is, talking about how wonderful her plan is. My sister had a friend that was on a plan that was covering her admission to the fitness organization that they belong to, and she said, "Oh, you need to join my Medicare plan because then you'll be able to come here for free." And my sister asked me about it, and I said, "Well, I think you ought to look into it a little bit further." And when she did, she realized none of her cardiologists would have been on that plan. She would have had to switch all new cardiologists, and that was not something that she was willing or wanting to do. I think everybody just has to look at what is your individual situation. And I like the idea that you're an independent agent. So you can help guide people to what's going to be the best options for them and give them all of the facts.
Yes, ma'am. We definitely do. 9 years. 9 years.
So if you are getting ready to turn 65 now, you have a window that you have to sign up in, right?
Whenever you're going on Medicare, it's what's called initial enrollment. So that'll be 3 months before your birthday, the month of, and then 3 months following. So that's a 7-month window. My recommendation is to get started early. That way, whenever your Medicare goes into effect, which is always the first of the month, of your birthday month, unless your birthday falls on the first of the month, then it actually goes back to the previous month.
Oh, so, wow.
But overall, otherwise, it's going to be the first of your birthday month. So if you're not being continually covered by group insurance past your Medicare effective date, then my opinion is to just, have your Medicare effective, have your Part B application done. And then the 3 months before, be able to look at and choose a supplemental type policy to pair with your original Medicare, that supplemental to go along with it. That way, the month of your Medicare going into effect, you have that coverage with that supplement for your out-of-pocket original Medicare cost.
Now, one thing I want to bring up too, that I just thought about as you were talking, is if you are on the Medicare plan and say you get an Advantage plan, can you then switch back the next year and change and say, you know what, I don't like this Advantage plan, this HMO or this PPO. I want to be on original Medicare. Can you switch back? And how would that work?
Yes, you can. Actually, let's say, for example, if you enrolled into a Medicare Advantage plan during open enrollment, or maybe even if you turned 65 during that year, but generally it's going to be during open enrollment, October 15th to December 7th. That plan that you do during that window of time, if you decide that that plan was not for you, then the government has issued or does provide a window of time that you can withdraw from that plan and go back to original Medicare. It's called annual disenrollment period, and it's January 1st to February 14th. Now, you can't disenroll from the Medicare Advantage and go to another Medicare Advantage. It would be to go back to original Medicare.
Okay. What would be would you have challenges then getting a Medi-Gap policy if, for instance, you had some medical issues that had arisen?
You are subject to underwriting questions, but you do have the ability to pick up a Medi-Gap policy. The Medi-Gap is the one where you can pay a monthly premium based on your zip code, and you have no network of physicians. So yes, you are able to have a Medi-Gap policy. Now, there are certain situations. If you had never been on a Medicare Advantage plan before, and you wanted to go on a Medicare supplement, then Medicare does give you a year to try a Medicare Advantage plan if it's your first one. So let's say you enroll in your first Medicare Advantage plan, you try it out for the first year. Anytime during that 12-month, that first year, you are able to go back to a Medi-Gap policy with no underwriting questions. So there are exceptions
Okay.
Right. There are, I would say, not just loopholes, but there are exceptions. So that's 1 year through Medicare. And then there are a couple of different carriers, or there is a carrier that actually will give you a second year trial. But so yes, there is that one possibility way going back.
Okay, that's good to know. That's good to know because I didn't know that. I had always understood that you absolutely, if you went to Medicare Advantage, then you were pretty much stuck with that because trying to switch back might be difficult to get approved for the Medi-Gap policy. But that is good to know. Thank you. Thank you.
Mm-hmm. Absolutely.
Yeah. So we've been here talking today with Jamie Spratley about Medicare basics, what you need to know. We have covered quite a bit of material, but it's in two live videos. So you might want to watch both of them to get all of the information. We'll bring Jamie on again and hopefully her partner, Nicole, as well to go through this again, probably sometime in September before open enrollment begins. We know that a lot of people are going to have a lot of questions. Reach out to Jamie and Nicole on their website. I've got it up on the screen right now. Make sure you reach out to them. Do you have a newsletter or anything, Jamie?
At this time, we do not, but we look to launch one in 2019.
Okay. All right. But you do have a great little video on Medicare basics on your website, and you've started a blog. So you're letting people know about different information and options. So if you have a question, reach out and ask them. They're there. They'll answer. They'll help you out. Jamie, is there anything else you want to say before we go?
No, just thank you for having me on. And then again, I do want to touch base on the video on our website. It goes over the basics of Medicare, the foundation of it. It is educational, so it is not tied to any specific company or plan, but it just is for educational purposes to understand what your options are and a little bit more in detail of what we discussed today. It's 7 minutes, so we didn't want to make it too overwhelming. But it's very user-friendly, and so feel free to go on there and watch that video. If you have any questions beyond that, feel free to reach out to us. Otherwise, just feel free to share it with anybody that you know that has questions in regards to Medicare as well, because the video is very good for answering basic questions.
Great. Okay. All right. So I'm going to go ahead and say goodbye to Jamie. Thank you so much for being on the show. And if you would like to be on the Life After 50 show, we air on Mondays at 11 a.m. Central Standard Time. And I'm always looking for people who have great information for Life After 50. So just go to the website on findhoustonseniorcare.com/guest-application and fill out the form, and we'll get back with you and see if you're a fit for the show. Thanks so much. And again, I want to thank Jamie Spratley for coming on the show today to help us with Medicare and answer some of those questions. Thanks to everybody, and appreciate you showing up. Have a great day.